You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome to another episode of the MotherToBaby Podcast. My name is Chris Stallman, and I am a mother of four. I know the intro says mother to three, but I just recently had a baby girl. I'm still a genetic counselor, and I'm still a teratogen information specialist. And so what we do is we give information about exposures during pregnancy, breastfeeding, before pregnancy, and in cases of adoption. And an exposure can be anything during pregnancy. So it could be a medication, it could be smoking, it could be alcohol, or an exposure that you have at your job. So there's a whole lot of things that we talk to a whole lot of people about. And today is going to be no exception. This is actually going to be part 2 of talking about IBD, which stands for Inflammatory Bowel Disease. And returning with us, we have Beth Kiernan from MotherToBaby California. Beth, thank you so much for coming back to the show today.
Thank you for having me.
My pleasure. So we also have our return caller, Amber, who herself is in charge of a podcast. It's called About IBD. And she told us a little bit about that on our last episode. So in case you didn't hear it, we do suggest that you go back and take a listen. But her podcast focuses on questions that she and other people in her community get about IBD in general. So not just pregnancy, but other experiences and things that go along with having and living with and loving people and caring for people with IBD. So we would definitely suggest you take a listen to that as well. And we're going to just jump right in and get to Amber. So Amber, thank you for returning to the show. What questions can Beth answer for you today?
Yeah, the next thing that comes up, and I know it happened for me when I was pregnant, and you're thinking all about your pregnancy, and then all of a sudden you're thinking about labor and delivery. But then at some point you go, oh my gosh, I'm going to be breastfeeding. I hope I'm going to be breastfeeding. And then you wonder, what about the medications that I'm receiving and breastfeeding? And should I make any changes, or who do I even talk to about learning more about this?
I cannot agree with you more. So I do not have IBD or any kind of autoimmune condition or any kind of chronic condition really, but I gotta tell you, this comes up all the time on the job. This comes up with friends. This came up with me when I was taking allergy medication, and I do this for a living. But at some point, it's like you said, you go from A to B. It is all that pregnancy world right there, and then boom, baby. And you're like, oh man, I was taking XYZ. Can I still do that? Do I know that? What's happening? Hormones, baby milk? I don't know what's going on. So yes, you are well versed in this condition. I mean, I'm sure you could teach many people a thing or two about a thing or two, and it doesn't even matter at that critical time where you're just like, what happens. So I'm very glad that you asked this, and I'm also very glad that you said you're thinking about breastfeeding, or you want to breastfeed. I appreciate that. I've had my own troubles with breastfeeding and keeping my milk supply intact. And so I appreciate that you understand that some people are willing, not always able. So thank you for that. And with that long-winded response being said, Beth, what about medications for IBD and breastfeeding?
This is a great question. Many women are choosing to breastfeed nowadays, and when you have a chronic condition, you may be extra concerned about any potential exposures for your baby. MotherToBaby specialists can give you information about breastfeeding while you're taking these medications, just as we give information about those medications and pregnancy. The information that you learn from the conversation with the specialist can then be an important part of a discussion that you have with your gastroenterologist, your pediatrician, even a lactation consultant, where all of you will come to a decision that's comfortable for you. At MotherToBaby, when you contact us with these types of questions, we'll provide information about how much medication, if any, gets into the breast milk, what the potential side effects might be for the baby, if there could be an effect on your milk supply. These are the kinds of things that we'll go over. breastfeeding is a great start for your baby, and having this information may help you feel more comfortable with your medication choices, and certainly in a conversation that you have with your healthcare providers. Sometimes we may not have a lot of information about newer medications. Sometimes we find that a drug is compatible with breastfeeding, but there's less known in pregnancy. There are definitely some interesting questions that are addressed in our calls, and we hope that we can be of assistance. Just know that Mother2Baby doesn't make recommendations about whether to take a medication or when to take a medication and then how soon afterwards to nurse. We provide that information, and then you take that to a conversation with your doctor and make your choices from there. But in general, I think we can usually be more reassuring than you'd expect. And women usually come away pretty grateful to have found this resource.
Oh, I would agree. We have a lot of repeat contacts who are pretty happy. Even though, like you said, there's not always a lot of information out there, and that makes it hard and scary and frustrating. It's like, well, there's a medication and I can get it prescribed, and hopefully my insurance will cover some of it. That's a whole different issue. But, why isn't there information, or is there something that we do know? Is there anything that I can take, to try and make this decision? And I do agree that that information is super important to have out there. Really, Amber, to address your question specifically, should I make any changes? The good thing about breastfeeding versus pregnancy is, as Beth had said in our last podcast, and it really is true, and it has been for a long time, about 50% of pregnancies in the US are unplanned. So in some cases, people are, for lack of a better term, taken by surprise with their pregnancy, and they're, sort of in a mad rush to understand, should they continue their medication, yes or no. The good thing about breastfeeding is that you've had this time before when you're pregnant, hopefully in that time to have had a conversation or 2 or 10 with your provider, with your healthcare team, with your baby's pediatrician, to talk about your medication use during breastfeeding. Hopefully there was some time to address it then. So it usually is not going to be such a surprise the way a pregnancy might be in some cases. The short of it is, though, in most cases, it's not going to be recommended to stop your medication or to make changes to how you take your medication without the guidance and the discussion with your healthcare team, which can include your baby's pediatrician. So you certainly can go to them and have these conversations. But as Beth said, us at Mother2Baby, we're focused on specifically giving information that we can find through, the peer-reviewed literature, the databases that we have, so we're able to give out accurate, up-to-date scientific information. And then you can take that back to your provider, or your provider can contact us. We can have a conversation with them as well. So we're a multifaceted resource. And so we're really eager to help you and your provider make those decisions, help give the information that can help you decide what's best for you and your family. So Beth, when you were on last time, you were kind enough to inform us about the Mother2Baby studies that are going on right now. And of course, our focus is on patients, and we want women who want to be a part of the studies to contact us. And we'll definitely have that contact information at the end of the podcast, like we always do. But what about healthcare providers? Are they able to refer to these studies?
Yes, absolutely. With their patient's approval, we can take the mother's contact information, her name and phone number, and then we can get in touch with her, explain the studies, screen her, and enroll her into the research so that she can play a valuable role in helping us learn more about these medications and pregnancy. I should also add that we have a pretty unique new project at Mother2Baby at UC San Diego, actually. We have a new breast milk biorepository. And so it's another opportunity for women to contribute to what we know about these medications. We can work with a woman to enroll her into our breast milk biorepository. The Mommy's Milk project has been going on for the last couple of years, and we have staff that would contact a mom and do a brief phone interview and then collect by FedEx a fresh expression of milk, a couple of drops of breast milk up to 2 ounces. That is then scheduled for a FedEx pickup and later on analyzed to determine things like the amount of medication that is contained in that sample and other factors, other important components of that milk. So that gives us more information, and then we use that in our work talking with women who want to breastfeed while taking these newer prescription drugs.
I think moms are unbelievable in a very positive way. I mean, they're taking care of everything. They're dealing with a global pandemic, and still they're like, yep, take my information. You can have a little bit of my breast milk. I want to help somebody else. That's such a mom thing to do.
It really is. And we are so appreciative. One of the best parts of my work is the privilege of being able to speak with women at this incredible time of their lives when they are pregnant and new parents. It's really, they are unbelievable.
No argument from me. Beth, thank you so much for returning to the show today. I know that you are a busy lady, so we really do appreciate that. Hope you and your family are staying as healthy as possible.
Thank you. Same to you.
Thank you. And Amber, thank you again for being on our show. And thank you to all of you in the audience for joining us for another episode. We really do appreciate it. Please feel free to subscribe so you never miss a new episode, or you can always listen or re-listen to previous episodes. And you can find us on Spotify, on iTunes, or however you listen to podcasts. And so we're ready to wrap up this episode. Thanks again for joining us. And in the meantime, if you want to contact MotherToBaby about your own questions, so if you have questions about the podcast, if there's something you want to hear on the podcast, or if you want to be a part of the podcast, please drop us an email at contactus@mothertobaby.org. If you have a question about an exposure, a medication, nail polish, anything during pregnancy, breastfeeding, before pregnancy, or adoption, feel free to give us a call toll free at 866-626-6847, or you can text us at 855-999-3525. Now, if you can't remember those numbers, you can always go to our website, MotherToBaby.org. You can find our fact sheets, which are going to be available in English and Spanish. And you can see more information about our studies. So head on over to MotherToBaby.org and take a look at what we have to offer. We hope that you will join us again in the future. This is Chris Stallman signing off, encouraging you to remember that MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.